So happy Congressman Krisnamoorthi has called into the show because a lot going on in your department too, Congressman. How you doing?
Hey, Anna, how are you?
I'm okay. I'm okay. There's so much going on in the world. You blink, you might miss something. And I know you've got a lot on your plate right now. One of the things we wanted to talk to you about is the vaccine and the idea that when one is available, and hopefully there will be one as soon as possible, that Congress would like to hold. You're holding hearings, or you'd like to hold them about what happens there. Give us an idea what's going on.
Yeah, well, thank you. As you know, we're not going to be able to resume life as normal until we have a vaccine and until we all get vaccinated. And what that means is first we have to develop a safe and effective vaccine, and that's something that the FDA, basically has to sign off on. And so what my subcommittee, it's called the Oversight Subcommittee on Economic and Consumer Policy, which I chair, what we are kind of requesting to know, along with some others, is what is the process by which this vaccine is going to be deemed safe and effective. We need to make sure that it is of a quality and of a level of safety that the American people can trust in it. And quite frankly, we can push back on what the anti-vaccination movement is trying to portray it as, which is something that's not safe, not effective, not something people need to get. But as you know, we can't all be safe until we reach herd immunity, which means that most of the population has to be vaccinated.
Yeah, I hear you there, Congressman. I know that you don't have to be an anti-vaxxer, though, to believe that the process here, they're speeding things up, right? We're trying because we desperately need this.
Yes.
And they've changed some of the rules and in terms of getting these things through. And I'm totally in support of that. But you wonder, does that make some people who normally would be like, sure, I'll sign up for it, sort of a little bit wary? And maybe the fact that it hasn't been tried on enough people, there aren't enough trials and that kind of thing. Any of that concern for you?
Yes. They started something at the White House called Operation Warp Speed to basically speed a vaccine to market, so to speak. And that really raised a lot of eyebrows in Washington and probably a lot of places, especially among researchers, clinicians, health experts, and scientists, because, when you develop a vaccine, you have to kind of go through certain processes and overcome certain hurdles. Just as an example, in a stage 3 clinical trial, which almost every vaccine has to undergo, you have to have at least 30,000 participants for that stage 3 trial to be declared kind of valid as far as the data is concerned. Another thing is the FDA usually designs the trial so that you can measure data and weigh the costs and benefits of the vaccine. And then third, they make the data transparent to other scientists and researchers and committees who help to validate the effectiveness of the vaccine. So with regard to these three issues, we have asked the Trump administration to basically confirm that they're going to observe these protocol, among others, because we can't get to a situation where we have some kind of vaccine that President Trump announces on the eve of the election, and people are, very unsure about its effectiveness, and people don't take it if it worked, and if it doesn't work, it would really be disastrous for building trust in the public long term.
So that's what this is about. You want to kind of get some answers to these kinds of questions.
Yes.
Hey, Congressman, I have a question here from a listener, and I'd like clarity on this too. I don't know if you can provide it, but I'll ask you. When the vaccine was first talked about, the most vulnerable people were the last ones to get the vaccine. It was proposed that essential workers, then the general population, then the elderly, and then the most vulnerable. Or is that your understanding too? How this would be rolled out?
It's a great question. That's actually one of the topics that we would like to learn more about, because I know that the Trump administration has been deliberating about this, and they've actually set up some committees internally on this issue. we need to have some transparency on this because, as you know, at least initially there's going to be not enough vaccines not enough doses to vaccinate everyone at once. And so the prioritization does matter. And some people believe that the most vulnerable, those who would be most at risk of developing COVID-19, should perhaps get it first. And then, perhaps younger people and others who may be less susceptible should get it after that or toward the end. But I think that this is another issue that we need to have a robust discussion of and at least some knowledge about what they're thinking on this issue.
How long would it take to roll it out? The vaccine, to get everybody who wants it to get it?
It's a great question. So essentially, what's happening right now is that actually the government is in part funding some of these companies that are at the stage 3 trial stage to basically start making doses of their vaccine even at the same time that they are being tested, because they need to get a running head start in order to basically vaccinate a sizable chunk of the population in a short order of time. It may take months. It may take a year to vaccinate everybody. You have 330 million people or so in the United States, and they might need more than one dose. You could talk about you could need upwards of 1 billion doses of the vaccine, for instance, and that's a lot of vaccine that has to be manufactured.
Congressman, we have a question from a listener. I don't mean to put you on the spot, but if you have an answer to this, then we certainly would appreciate it. Demetra, go ahead. You're on WGN. Question for the Congressman?
Sure. Hello to both of you, and thank you for doing such a wonderful job in Congress for us. But I do have this question. I've always heard that viruses are not like flus. You cannot treat them with vaccinations. So I don't understand why they're even coming out with this. Unless, there's a money-making venture at the end. And I'm sorry, but that's just, what I don't understand.
All right. What do you say to that, Congressman? Thanks for the question. Demetra, Congressman?
Yeah. So COVID-19 it's not the flu, but it's from a similar family, and those can be treated by basically vaccines that stimulate the production of antibodies, which basically combat or kill the virus. And so it's very important that you get the types of antibody response that we need to basically be effective. And that is really the crux of the problem in developing these vaccines.
Mm-hmm.
Well, why not just take extra vitamin C or D or zinc?
Well, it's not been shown that those are therapeutic treatments for this particular type of disease. This is not like the common cold. This is something that is very serious, and therefore you need a vaccine and other therapies to really deal with it.
All right, Congressman, I appreciate the time. When will one of these hearings beginning, and when will we start collecting some of the news and the interesting things, the details that emerge from these?
It's a good question, Anna. Stay tuned. We have been, my subcommittee has been somewhat successful in its oversight of the FDA and kind of pressuring them to give us answers to important questions. They are unfortunately dragging their feet on this particular issue, and I hope that they are more forthcoming, because this is an issue that, as probably your callers and audience knows, everybody is very, very interested in right now.
Yeah, for sure. Hey, I got to ask you one more thing. Tammy Duckworth is being named as her name's coming up a lot for the VP with Joe Biden to be on the ticket. What do you think about that pick?
Oh my gosh, it would be fabulous. I mean, Tammy Duckworth is a patriot. She's a hero. She's been in the House and the Senate. She's also been in the executive branch. There are few people who are more qualified, And as you know, we sent our favorite son to the White House in Barack Obama, 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 in Barack Obama.